Before I started medical school, I didn't know anything about it other than it was gonna be really busy. I didn't know why I'd be busy. I didn't know what the structure of medical school was. So that's what I want to share in this video, because I've spent my first year in medical school. And if you're an aspiring medical student or just anyone who's interested, this video should hopefully give you an idea about what you can expect. Hi everyone, my name is Nisal. I'm a second year medical student in Australia. And first, let's talk about how medical school is actually structured. So I go to Western Sydney University, which is a 5-year medical program, and the first 2 years are preclinical, which means for 2 years you're getting all the knowledge about medicine. And from your third year onwards, years 3, 4 and 5, you're pretty much doing your clinical years, which is you're in a hospital doing rotations. Like 3 months you'll be with like a mental health department, 3 months you'll be with like a surgical department. The year I want to talk about is my first year, which is the first year of preclinical, and we started off like mid-February of this year. That semester went on till the start of June, and then we had like a 3-week break which went by in like a flash. And then we started again at the start of July, and that semester went on till the end of October. And then your November, December and January is completely free. You're on vacation. If you really wanted to, you could do like a summer scholarship project or get into like a bit of research. If not, it's completely reasonable to just completely take the 3 months off, because you have to work really hard throughout the year. And in the first semester, we learned a bit about everything. Like the first 8 weeks, we had like a bunch of lectures around an introduction to the human body, which is really interesting. And I think the 9th week we had like a week off, mid-semester break, which is usually spent catching up on all the lectures that you missed. And after we came back from that mid-semester break, we had like 5 weeks of learning about nutrition and metabolism. That was really interesting. We learned about like type 1 diabetes, type 2 and different things like that. And then, like I said, we had our 3-week break. And in the second semester, it was more structured. First off, we had like 5 weeks learning about the gastrointestinal system. So your abdomen, anatomy, how food works. And then after that, we had 4 weeks of learning about cardio. So everything about the heart. And that was followed up by another 5 weeks of learning about the respiratory system. So everything to do with your lungs, respiration, asthma. A lot of people find this very hard because there's a lot more maths and equations than usual. That's sort of about how it's structured in first year. But the biggest shock for me when I started medical school is the schedule. And the cool part is our medical school actually gives you like a customized timetable for each student. So on Monday, we started off with a class called PBL, so problem-based learning. And in this PBL class, we get presented with a case. This could be anything from like a person has a headache to their leg is broken or something. But the cool part about it is they kind of give you information bit by bit. For example, the first slide that comes up might be like a 37-year-old woman comes to your like GP clinic and they have like abdominal pain. So this class only has like 10 students and 1 professor. And the students have to kind of discuss amongst ourselves about what problem this could be. Is it related to like a gastrointestinal system? Could it be something to do with the heart? Could it do something with the urinary system? Along with what sort of questions we'd ask this patient to learn more about their condition and why this happened. So when we kind of figure out what we want to do, we get like the next piece of information. The professor isn't there to like teach us anything. They're more there to guide us through the case. If we're chasing like a complete dead end, then they'd be like, oh, let's actually park that idea and we'll come back to this piece of information that was vital and she mentioned in like the first slide. So it's an interesting way of learning, and at the end of it, depending on what the problem is, we come up with a list of learning objectives. And then our Monday class finishes and we each have to go and research these learning objectives. And then we have a class on Friday that I'll talk about later, where we actually have to present these learning objectives and what we've learned. So that's our Monday. Moving on to Tuesday. So Tuesday is my hospital day, and this class is called ICM, Introduction to Clinical Medicine. It's a small class, like 1.5 hours, but it's really useful because there's 5 students and 1 doctor that we get to learn from and go to the hospital with. So we'll have sort of like a workshop depending on what lectures are there that week. Our like ICM class is sort of aligned with that. So I remember one time our like week of lectures was mostly about alcohol consumption, problems that can happen with the liver. Our ICM class was about alcohol consumption and how to calculate like standard drinks and how to even talk to patients about alcohol, because it's a very sensitive topic. And after we've had this like sort of chat in the room with the doctor, we usually go to the hospital and actually talk to patients. And towards the second semester, we learn how to do a gastrointestinal examination, cardiological examination, and a respiratory examination as well. Wednesday is reserved for like a range of classes. It can be an anatomy lab class, a computer practical class. It can be a class called MIC, so medicine in context. It can be a class called PPD, personal professional development. It can be a class called Pop Health, population health, where that's sort of like a research unit. So Thursday is actually my free day, which is great. You do need a free day to catch up on your studying. I usually work on this day because I need to earn some money and then pay for, basic expenses. But this free day kind of depends on your clinical school. So I'm at MacArthur Clinical School, and MacArthur Clinical School has their ICM classes on Tuesday. And that's why I have my ICM class on Tuesday. But if someone was at the Blacktown Clinical School, which is other clinical school that we're associated with, they actually have their classes on Thursday and would have their Tuesday off. And to finish off the week, we have another PBL class on Friday. And this PBL class, like I mentioned before, is all about presenting what you learned from those learning objectives. And the worst part is you don't know which learning object you will have to present on. So you have to research them all. And when you're in the class, your professor or teacher will be like, okay, you get this learning objective, you get this learning objective. And then we kind of pick a whiteboard and then write all the information that we found out about that and then present it to the class. The really cool thing about PBLs also is that similar to the ICM classes, they're sort of integrated into what lectures we're studying about that week. I remember one time all our lectures were about the layers of the skin and genetics, and our PBL class was about skin cancer and how it can present. So it's a really interesting way of learning. The last but definitely not the least thing to mention is lectures. So our lectures are all online, they're all pre-recorded and you can watch them on your own time. But the problem is there's like 8 to 10 lectures per week and they're about like an hour long. For me at least, usually by like the second or third week, I'm already trying to catch up on lectures from like week 1 that I missed. That's why like the mid-semester break is really nice because you can catch up on all the lectures that you missed. So that's really where things become busy because you have to complete all these lectures, make notes because sometimes the lectures aren't that great, so you have to do your own research, make your own note, and then you have to research for PBL as well. If you have ICM, you might have to read up a little bit for that. If you have like MIC and PPD and population health, you might have an assignment for that, so you'll have to spend a little bit of time doing that. It becomes a lot of work, and one thing I definitely recommend is finding a study group because like you can only cover so much by yourself, like I've tried. And me actively trying is also falling behind on certain lectures because I physically did not have the time to do them. The great thing about a study group is rather than spending like an hour watching a certain lecture, not understanding it, going on Google and like AI and trying to figure this thing out and then making your own note, which is like a 3-4 hour process. You can just get your friend to explain exactly what they understood from the lecture and what the important parts are. Moving on to the exam structure, it's done very differently. I found it really surprising to know at first that medicine is actually a pass or fail system. So there's no like high distinctions, credits, passes, nothing. It's only pass or fail. The good thing about passing is you pass and you move on to the next year. The bad thing about failing is that you have to repeat that whole year again. Even though you study like one semester and then second semester, you're assessed for the whole year. So in the first semester, like I said, we go over the introduction to the human body and the nutrition and metabolism stuff. And then we have an MCQ and SAQ exam. It counts for 44%. Okay, so the MCQ exam is 22% and the SAQ exam counts for 22% as well. In the second semester, like I said, you have gastrointestinal, cardio and respiratory. You also have one MCQ and SAQ exam. These exams collectively combine to a score of 56%. So you have 44% from semester 1, 56% from semester 2, combined together you have 100. And in addition to these exams, you also have something called an OSCE exam. and that's more testing your like clinical experience. So like I said, in those ICM classes, you go to the hospital, you talk to patients, you take their history, ask them what they've come in with, and the last but scariest exam is the anatomy exam, because of course anatomy is really important for medicine. You have like 2.5 minutes per station, and there's like 16 stations. So it's a 40-minute exam altogether. But that's essentially how my first year went in medical school. If you're interested to know some more things that I found really interesting about medical school, make sure to check out this video, and I'll definitely catch you in the next one.